Well, good morning. Happy Sunday. Happy coffee with Dr. Childress. So, today I want to be discussing the failure of empathy from the professional psychologists in the family courts. And this is a topic that absolutely sends me up the it makes me crazy and has for the past decade as I'm over here in the family courts. So, hopefully I won't blow my head apart talking about this. Empathy is foundational to the practice of professional psychology, understanding other people's place in the world, their experience in the world, so that we can help them navigate their situations out of their suffering and pain. We're healers in the mental health field, and, and empathy is central to that. When we train psychologists, the first model we train them in is Carl Rogers' um, client centered therapy, which is empathy, unconditional positive regard, and genuineness. And what Rogers maintained, and I agree with him, is that those three conditions, if we provide those conditions, empathy, genuineness, and unconditional positive regard, people will grow uh, into their health. The issue with empathy, though, the way we teach it initially is kind of like reflective listening, the skills of the therapist. So somebody says, "Oh, I'm really hurting," and it sounds like you're hurting. That's a reflective listening that communicates empathy, but it can go much deeper than that simple reflective listening, and that's where the empathy really achieves its power. Is when we are able to empathize with the client and share things from our empathy that they were unaware of themselves or were ill formed or not fully formed within themselves. And then our empathic resonance with them helps bring that aspect of themselves into their awareness. And so that the empathy is critical to everything we do as a uh, clinical psychologist or psychologist, mental health professional. And in the family courts, because of the danger associated with the family courts, all the clinical psychologists have left. So you don't have any clinical psychologists over here. The professional response to the risk management situation in the family courts, professionally for us, was to give you your own special psychologists. We call them forensic psychologists. And no other pathology has their own special psychologists, not autism, not ADHD, not eating disorders, not substance abuse. All the other pathologies are treated by clinical psychologists. And they're not dangerous to us. All the other pathologies want clinical psychologists there because we're helpful. But the family courts drives us away because we're trying to solve the pathology. That's what we do. We solve the pathology. And there is one party there that doesn't want the pathology solved, the pathological parent. They're narcissistic, borderline, dark personality, very vengeful, retaliatory, and delusional, persecutory delusions. And they are very dangerous to our professional license. And then the court system itself, with the adversarial system and opposing counsel, is very dangerous. And now it's just simply dangerous for clinical psychologists to come here because the forensic psychologists will retaliate against us because we're not them. We're not doing what they do. And so clinical psychologists haven't been here for 40 years, which is why there's nothing solved over here in 40 years. I kind of watched it, an old guy, kind of watched it back in the 80s happen, and they banished all clinical psychologists from making any custody recommendations, and only forensic psychologists could say anything about custody. Now, that's a wrong decision to begin with because there's a lot of reasons to that would influence custody decisions, such as child abuse. And clinical psychologists can absolutely speak to child abuse and parenting concerns and a number of issues, treatment related issues that would bear relevance to custody related decisions. But we're not allowed to talk about that because only forensic psychologists can give a custody opinion. But all they have to do to give a custody opinion is perform a set of rituals. They have to interview everybody, they tape record the interviews, and then they basically report on the transcripts of the interviews without any processing of the information or analysis of it. They do some minor testing, MMPI, or some vague self report inventory sometimes that really don't show very much or are not particularly useful or helpful. And then they make an opinion based on nothing. They don't apply any knowledge from professional psychology, not attachment, not family systems, not delusional thought disorders, DSM. They don't diagnose anything. And so after 9 months of this bloated, lethargic assessment of possible child abuse, they return a report with no diagnosis and no treatment plan. We still need a treatment plan. We still need a diagnosis as to what the problem is. So even after their 6 to 9 month evaluation for $20,000 to $40,000, we still need another evaluation. We still need another risk assessment for possible child abuse. So they're an absolute waste of time and money, and it's simply financial exploitation of these families. And I can go into forensic psychology till the cows come home. But that's the fundamental issue, is that you've been assigned the worst possible mental health professionals that are ignorant, incompetent, unethical, and just awful. And that's your only choice because clinical psychologists won't come to work in the family courts because that's the nature, the structure of the current situation. So what psychology needs to do is we need to go back and relook at how we handle risk management in the family courts and to develop an alternative model. That's what I'm doing. I'm a court-involved clinical psychologist. So I've remained a clinical psychologist working in the family courts. That's very dangerous for me because I don't have the cover and protection of being a forensic psychologist. And so everybody wants to hurt me. Forensic psychologist, opposing counsel, and the pathology all want to get me gone, damage my license, attack me. And so I have to stay active in my risk management at this point in time. Forensic psychology is a failed model of service delivery to a vulnerable population. And it's failed for 40 years. That's clearly evident. Professional psychology, the American Psychological Association, needs to revisit the issue of how we are dealing with risk management professionally in the family courts. And the practice of forensic custody evaluations needs to die. It needs to end. It is an abomination. It is exploitation. It is malpractice. And I'll debate this with any forensic psychologist in any forum at any time. So just put me on the side talking in defense of clinical psychology's return to the family courts. Pick a forensic psychologist, put them on the other side of an online debate. Let them defend their practices, and I'll defend the practices and the approach of a return of clinical psychology. But in order to do that, we have to stay safe. And there's ways to do that. We just have to structure the diagnostic assessment protocol, structure the treatment protocol, and get the legal arguments in support of that. And that will keep us safe. So we would be doing essentially the same thing that the forensic psychologists do, which is structure our assessment, but we would be structuring it within established knowledge of clinical psychology, assessment, diagnosis, and treatment of pathology. Custody decisions are the court's decision. There's really only two custody schedules possible. Typically 50-50. You can do it mixed week or you can do it alternate weeks. Some variant of roughly 50-50 custody. Or one parent gets school week primacy and the other one gets every other weekend and the night during the week. That's the only two choices basically. For distance, one parent gets school year, the other parent gets vacation. The custody issues or decisions are not hard. They're very simple. And the issue is the attachment pathology and the family conflict. And that's where everything gets seemingly more complex. However, the differential diagnosis for severe attachment pathology is possible child abuse by one parent or the other. That's the only thing that causes attachment pathology is pathogenic parenting. So one parent or the other is creating that severe attachment pathology in the child. And problematic parenting creates an insecure attachment that more strongly motivates the bond or motivates the child to bond to the parent. So we never see a child seeking to reject a parent, sever the parent-child bond, except possibly in abusive situations, sex abuse or severe physical abuse or something. The not even then, but that's a differential diagnosis. Is the targeted parent abusing the child, creating the child's attachment pathology towards that parent? That's a two-person attribution of causality. Or is the allied parent psychologically abusing the child by creating a shared persecutory delusion and false attachment pathology in the child for secondary gain of manipulating the court's decisions on child custody? So we have child abuse by the targeted parent, two-person attribution of causality, or psychological child abuse by the allied parent, a three-person triangular attribution of causality. So that's the differential diagnosis we need to assess for, and it should be routinely assessed in all cases of court-involved family conflict. So 90% of parents after divorce effectively resolve their child custody issues without much court involvement. They might need a little initial decision about which custody schedule, but once the court makes a decision on child custody, normal range people are able to accommodate to the court orders and court decisions, and they have normal range empathy for their child. So they realize that going with the conflict around child custody is just going to rip the child apart. And so they bring their spousal conflict down and they cooperate with each other surrounding the child because they have normal range empathy for the child. When you have a family coming back into the family courts with the highly litigated custody conflict, we got at least one parent who's not normal range empathy. We got one parent who cannot follow court orders or contain themselves within court orders. And so that's your narcissistic borderline dark personality, most likely. And so 10% are high conflict divorces. And interestingly, about 10% of the population is narcissistic or borderline personality disorder. So that's what we have in the family courts, is a personality pathology in a parent coming back. So when the court sees a custody conflict come back into the courts, when there's child attachment pathology, so the child's rejecting a parent or there's some sort of conflict in that situation, the court's not in a position to decide what the family conflict is. The judges aren't trained in child and family therapy. It's the psychologists who are. So we need to get psychology input on the diagnosis. The psychologists need to identify which parent is creating the child's attachment pathology, and that's likely child abuse by a parent to create that level of severe attachment pathology. So the courts should just sort of routinely bump these cases back out to get a clinical diagnostic assessment for possible child abuse, a risk assessment for possible child abuse. But they don't, because that's not available to the courts. Clinical psychologists are gone. There's nobody here to do a risk assessment for possible child abuse. There's nobody here who knows attachment pathology. There's no one here who knows family systems therapy. There's no one here who knows delusional thought disorders. They're all forensic psychologists who want to be mini judges deciding on which parent deserves to be a parent. And that's harmful to somebody. When you restrict either parent's time or involvement with the child, you're going to damage the child's attachment bond to that parent, thereby harming the child and harming the parent. Plus, with a shared delusional disorder possible, if you misdiagnose the pathology, you become part of the shared delusion. If you believe the shared delusion is true, then you become part of the shared delusion. You become part of the pathology. And when that pathology is child abuse, you become part of the child abuse. So the forensic psychologist, by failing to properly assess the pathology in the family courts that they're looking at, the attachment pathology, they are frequently misdiagnosing or underdiagnosing the pathology in the family and are participating in the psychological abuse of the child. But what I want to talk about today is not the psychological abuse of the child and not the court system and how to alter that to get it to be more effective. What I want to talk about today is the profound failure of empathy from the family court psychologists, the forensic psychologists, regarding the parent, the targeted, rejected parent. That the brutality and cruelty of this pathology is phenomenal. It is, at its core, a spousal abuse pathology. DSM-5 V995.82, spouse or partner abuse, psychological. That's what this pathology is. It's using the child as a weapon to inflict immense emotional and psychological suffering on the ex-spouse, using the child as a weapon. And in weaponizing the child into the spousal conflict, the allied pathological parent, narcissistic, borderline, dark parent, creates such significant pathology in the child, attachment pathology, delusional thought disorders, that it rises to the level of child abuse. So the child abuse, though, is actually a secondary outcome of the spousal abuse, which is the primary driving force within the pathology. And so there's two dangerous pathologies that require a proper risk assessment. Possible spousal abuse of the targeted, rejected parent using the child as a weapon, and possible psychological abuse of the child by the allied parent creating a shared persecutory delusion, false attachment pathology in the child for secondary gain of manipulating the court and meeting their own emotional and psychological needs. And so that should be routinely done by all psychologists, and it's not. So that all of them, every single psychologist doing this right now is failing in their duty to protect the child, failing in their duty to protect the parent, the targeted rejected parent, by failing to conduct a proper risk assessment for possible spousal abuse and possible child abuse. Now, if they conduct the assessment, find it's not spousal abuse or child abuse, that's fine. But conduct the proper assessment. Is there a shared persecutory delusion in that child? Is the child being used as a weapon? Now, in terms of the targeted parent, the rejected parent, I taught lifespan development courses at the graduate level, taught them several times. And they tend to structure around this one model, Erickson's model of lifespan development, where we went from childhood to old age and developed stages for it. And now there's several others that kind of float around. But everybody Erickson kind of nailed it. He was a psychoanalyst. And so he kind of put us on that path of understanding the different developmental phases we go through in life. And in childhood, let me see. I mean, the first phase is the basic trust versus basic mistrust. So that's your infant situation. Let me grab up my list here. So the trust versus mistrust is the infancy, and then in toddler years, it's kind of the poop toilet training years. We get autonomy and shame and doubt as the child begins to become more mobile uh, and but then has to restrict themselves in the preschool years, showing initiative, but then you're getting into trouble and guilt. School years, the industry versus inferiority refers to the child um, being successful in school, being successful in soccer, making friends socially, all those sorts of things in the middle school years, or unsuccessfully in the sense of inferiority with that. Then we enter the teenage years of developing identity, but if you don't develop a solid sense of identity, you could be, self-doubt and confusion. Um, Interestingly, there's a new stage added to Erickson that I ran into last time I taught the course. I was looking through the curriculum in the book, and they there's been a new stage called emerging adulthood that's in Western societies, not Western industrialized societies, where young people are putting off entering the workforce and starting a family until later 20s. Used to be, 1930s and 40s, you graduate from high school and you marry and go work at the factory for 40 years and start a family. But that's changed in our society. So we have a new phase in some of our cultures called emerging adulthood, followed by intimacy and isolation. So intimacy is that pair bonding, you getting married, finding a mate, or else you're not, and that's the isolation part. So you're either successfully managing it or unsuccessfully. Then stage seven of Erickson is called generativity versus stagnation, and that's the critical phase that I want to talk about here. Um, the next one, ego, identity, and despair. Ego, integrity, and despair is what I'm in right now. Trying to keep out of the despair. Um, kind of organizing the old age and feeling comfortable watching sunsets and that sort of thing. But that generativity stage, um, that's an important stage for human beings. It's our adult life, and we generate a sense of identity and a sense of meaning in our life primarily through two roles. Um, our work role. What do you do for a living? Everybody asks you for saying, what do you do for a living? What's your role? Are you successful in your career, or are you unable to get your feet under you in terms of your career? The other central role is as a parent, as a mother or father, and generating a family. And when so everybody has, first thing they typically ask you when they meet you is, what do you do for a living? So identify your role, but also the role as a parent, as a mom or a dad, is central to who we are, and essential to our life. We've grown up as children wanting to be a parent. When I become a parent, and that's core of our meaning about things. When the child is born, we lose our names. We're no longer John or Mary. We become mom or dad. That's our identity. And so prior to the divorce, this parent, the targeted parent, had a child and had a family and had an identity as mom or dad. That's their core of their meaning in life. After the divorce, that child's been taken from them. They don't have a child anymore. That's ripping from them their entire sense of self identity and meaning. They're no longer mom or dad. Before the divorce, they had a child. After the divorce, they don't have a child. What happened to their child? Somebody killed their child. They don't have, and all that immense grief, as if somebody just killed their child. They don't have a child anymore. that immense grief and loss and hole in their life is just phenomenal off of that. Who killed that parent's child? The child did. The child is being forced by the allied pathological parent to kill the child of the other parent. That is immensely cruel. That absence of empathy from that pathological parent, and that is immensely, immensely cruel to do that to somebody. And all the forensic psychologists are absolutely flatlining on empathy for that. And they are participating in. I'll read forensic reports where they say, oh, yeah, we should, allow this to happen. That the parent loses a child. And nobody recommends any treatment for the parent or therapy for the grief, the loss therapy, nothing. They just throw them out. And these parents have their hearts ripped out, their life meaning just destroyed. Their life is destroyed. They have one chance to come through life. That's it, one chance. One chance to be a mom or a dad, and their child's growing up. And that's been robbed from them, taken from them. By what? By who? By why? Because of these false allegations that they're somehow malevolently treating their child or they're bad to their child. They're not bad to their child. They just want to be a normal parent. They just happen to marry a narcissistic, borderline, dark personality parent who just is extraordinarily manipulative and extraordinarily cruel. So the fundamental absence of empathy for the targeted, rejected parent in the family courts from the psychologists is an abomination, absolute abomination. That the cruelty, this is the most brutal and cruel pathology I have ever worked with. I have worked with spina bifida, spinal cord injury, puts kids in wheelchairs and stuff. And there's a type of grief for the parent in that situation called traumatic grief. That's when I first learned about the pathology of traumatic grief. It's a grief that cannot be resolved because the parent on the spina bifida, on the birth defect, had an expectation, a hope for a child and a family, and both parents are really happy, and they're going down a particular path. Then they learn in the delivery room that their child has a major birth defect, and that course in their life takes a major change. Now they're highly medicalized, their child's in a wheelchair, all their fantasies about that child and what they were going to do with their life and have been lost, devastated. And so there's a tremendous grief about the loss of that life and that hopes and dreams. And yet they can't grieve because they actually do have a child. It's not like the child died, they have a child. And so they're not able to process or fully grieve that situation. And so it just stays an open-ended grief over the course of a lifespan. And that's called traumatic grief. And so that's where I first learned about traumatic grief. But that's what's happening in the family courts. All these targeted parents, I diagnosed them with traumatic grief, complex post-traumatic stress disorder, and then I put parentheses, traumatic grief. Would be my diagnosis for them. Immense suffering in these parents. And yet I don't see any treatment programs being developed by forensic psychologists for the parents without children. What are we doing for these parents to help them grieve the loss of their children? Not a single forensic psychologist is coming up with a program for that. 40 years. And yet they are participating in taking these children away from their parents. It's an abomination, absolute abomination. So I'm over here in the family courts as a clinical psychologist, looking at both the failure of to conduct proper risk assessments for spousal abuse, for child abuse, also because of that, they're participating in the spousal abuse and child abuse. And they are not treating the spousal abuse or the child abuse or diagnosing it or telling the court about it or doing any. All the forensic psychologists, every single one of them that's practicing over here right now, needs to lose their license. That's my opinion. They all need to lose their license for the immense cruelty they are putting these parents through, and the absence of empathy, the cold hearts of these psychologists are just phenomenal. So I wanted to put that back on the table regarding this pathology, because the pathology itself is extraordinarily manipulative, and you have no idea. This is a pathology of lies, and every little thing about it is a lie. Everything. And you guys don't realize it, but I do, because I'm a psychologist, work with narcissistic personality pathology. I know how it manipulates. And so I can see exactly what it's doing. And what it does is it says, oh, when you scream as a parent, when you go, ow, this is really hurt, my loss, my grief, I love my child, the response you'll get is, this isn't about you, it's about the child. No, that's a lie. This is entirely about you. This is spousal abuse using the child as a weapon. This is spousal abuse. And they're not diagnosing, they're saying it's not about you. Yes, it is. And in weaponizing the child, it's child psychological abuse. That's another fundamental cruelty associated with this pathology, is that the parent, who the normal range parent who loves their child dearly, has to watch as their child is twisted up into this unrecognizable, angry, terrified, fearful, symptomatic child who does not like them. And they watch their child's life destroyed by this narcissistic, borderline, dark personality ex-spouse, and they can't stop it. They tell the other mental health people, and they just don't even attend to it. They just say the allegation is that it must be you doing something wrong. No, it's a triangle. It's a three-person attribution of causality. Family systems. All families, all families, all families in conflict break down into three-person triangular conflicts, because a two-person conflict is unstable. It's like having a two-legged chair. You just fall over. If you add a third leg, now you get a stool and it's stable. So conflict goes into a three-person triangle. That's foundational to family systems. And yet these stupid, ignorant, incompetent, unethical, and cruel mental health professionals, lazy mental health professionals, think it's a two-person conflict, because they're just ignorant like a rock and lazy like a rock. Talking about their laziness, and this kills me. This is just the stuff that has my head exploding. And so, I'm keeping myself calm. I, honest to God, want their licenses to practice revoked for the immense cruelty they're inflicting upon their patients. And yet, if the parent goes up and tries to argue with them or talk about it or deal with it, they face retaliation from the mental health people. I've asked parents to go up and ask their therapist for the diagnostic checklist, and that'd be an easy way. Just tell me what the three symptoms are. We can tell it right away. They're told no. No, I'm not going to tell you what the symptoms are with your child. What? What do you mean you're not going to tell me what the symptoms are for your child? And they get in trouble because then they say that the parent's being argumentative or not cooperative with therapy, and they use their power to retaliate against the parent who's just standing up for their rights, ethical rights, competency rights. And so I had to stop asking parents a couple years ago to ask their therapist for the symptoms display, because I was getting reports back that the therapists were retaliating against the parents. Unbelievable. The quality of these mental health professionals is beneath, it's subterranean. Lazy. Dr. Childress is not an expert. Dr. Childress is not the ceiling. Dr. Childress is competent. Dr. Childress is the floor. If you, as a mental health professional, do not know as much about this pathology as Dr. Childress, why not? Are you just lazy? You must be, because I learned it all and you're just lazy. Or don't you think that knowledge applies to the work you do? You don't have to know stuff. You don't have to be competent. You can just like wander in and savage people's lives because you are entitled to do that. No. If you don't know as much as Dr. Childress does, you're just lazy. That's just fundamentally it. And here's when I encounter psychologists, and I'm starting to encounter them. This is the standard you will find from Dr. Childress. I should not have to explain to you what the pathology is that you're working with in order to have a professional level discussion with you about the pathology. You should already know. I should not have to explain family systems therapy to you. I should not have to explain the attachment system to you. I should not have to explain delusional thought disorders to you. You should already know. That's standard 2.01 of the APA Ethics Code. If I have to explain it to you, you're incompetent. You need to get sanctioned and potentially lose your license for participating in the psychological abuse of children and their parents. So that's the situation. Okay. Forensic psychology is going to be facing some interesting questions as they encounter Dr. Childress, a clinical psychologist working in the family courts. And I'm the first clinical psychologist to come back. What the situation is involving is a family systems process called the homeostatic balance. The system is stable. The system in the family court, the dysfunctional system in the family court, is stable with the symptom present. So the symptom is stabilizing a dysfunctional family system. The symptom is the abject ignorance, incompetence, unethical practice, ethical malpractice of the forensic psychologist. So we cannot remove the forensic psychologists and their ignorance and incompetence because they're stabilizing a dysfunctional system. Every aspect of that system will seek to maintain that symptom present. I know that. I knew that 10 years ago. That's principles of systems, kind of homeostatic balance is stable with the symptom present. So what we have to do, Salvador Minuchin, we have to first disrupt the homeostatic balance. And so we have to kind of create a little bit of chaos here and disrupt the homeostatic. And then as it seeks to reorganize itself again, then we can take out the symptom and help it guide it back into a healthy system. That's systems therapy. That's what I'm doing. I am disrupting the dysfunctional family or dysfunctional system in the family courts, forensic psychology, and the ignorance and incompetence by bringing knowledge and competence to the family courts and the return of clinical psychology. So I'm not playing their game of forensic psychology or parental alienation. I'm not playing that. I'm not playing their game. And so now they're going to have to readjust and deal with the information that I'm bringing in as a clinical psychologist, that this is a delusional thought disorder, persecutory delusion, it's a trauma origin delusion stemming from the psychological collapse of a narcissistic borderline dark personality surrounding the divorce. They're going into a persecutory delusion, creating it in the child, and creating a false attachment pathology in the child for the secondary gain of manipulating the court and meeting their own needs. That's a factitious disorder, an artificially created false disorder, attachment disorder, imposed on the child, a factitious disorder imposed on the child, classically called Munchausen by proxy. I have background in diagnosing Munchausen by proxy from training in family courts, not family courts, in children's hospitals. Okay, so I was on medical staff at Children's Hospital of Orange County as a pediatric psychologist. When a physician at a children's hospital becomes worried about factitious disorder imposed on another, Munchausen by proxy, because the chart's that big and there's no solution, guess what we have in the family courts? Charts that big to go on for years and no solution. When the physician sees that and sees that the diagnosis, we're not really getting a good diagnosis on anything, but we got pathology, and they begin to suspect factitious disorder imposed on another, what they do is they call down or have their nurse call down to the psych department and ask for a psych consult. Can we get a psych consult up here on a possible factitious disorder? The psychology department sends up one of their pediatric psychologists. I'm a pediatric psychologist who makes the diagnosis of the FDIA. Pediatric psychologists in children's hospitals are the most experienced people on the planet in the diagnostic assessment of FDIA. And that's what this is. I'm a clinical psychologist over here. I'm making that diagnosis. That's what this is. This is a false attachment pathology imposed on the child for secondary gain of manipulating the court, meeting the parent's own emotional and psychological needs. And I will debate that with any forensic psychologist anytime. Gosh darn it, let's get, if anybody wants to solve this, anybody, the court system, lawyers, bar associations, APA, anybody wants to solve this, simple. Post an online moderated debate, 2 hours, the role of clinical versus forensic psychology in the family courts. Get Dr. Childress to represent for clinical psychology. Get anybody you want to represent for forensic psychology. Let's put it on a 2-hour debate online so everybody on the planet, in the Netherlands, in England, in Canada, in New York, in Virginia, and wherever, can watch it. All the family law attorneys can watch it. All the judges can watch it. All the psychologists can watch it. And watch the debate and have an educated, informed discussion about what are we going to do about the stuff going on in the family courts. We know it's not working. 40 years, high conflict divorce. Everybody's still flailing around in the forensic psychology. So, I see a reference to Matthew Sullivan. I've in the comments, I've got a blog post where I look at Matthew Sullivan, who's big forensic psychologist, former head of the AFCC. I look at do an analysis of his vita, and I did an analysis right before that of Dorsey's vita. Dorsey's a businesswoman and family coach. Matthew Sullivan is big head honcho forensic psychologist. My analysis of their vita is Dorsey's got a stronger professional vita than Matthew Sullivan does regarding this pathology, which speaks to the absolutely low level of forensic psychologists. Their vita's so thin. They just work in the family courts. They've never worked with attachment pathology. They've never worked with child therapy, school-related problems, just general child therapy. They don't know attachment. They don't know delusional thought disorders. Not a chance they know delusional thought disorders. They don't consult on it either. And so that's a violation 2.01. Boundaries of competence. If you don't know delusional thought disorders and how to diagnostically assess for that, and they don't, it's a mental status exam of thought and perception, one of the most difficult of the mental status exams. If they don't know how to conduct that, then they should be consulting on it, standard 2.01 B and C. But they're not. They're not consulting on that. They're just making ignorant decisions and destroying the lives of parents in the process, and destroying the lives of children. These children are going to face lifelong problems, lifelong. The destruction of the child. 4 diagnoses of child abuse in the family courts, or just generally, 4 diagnoses in the DSM-5. Physical abuse, sexual abuse, neglect, and psychological abuse. Each of those diagnoses are equally as devastating to the child. They differ only in the type of damage done, not in the extent of damage done. And child psychological abuse destroys a child from the inside out. So That's what the child is facing. I rate I got the sun coming in here. I rate the most severe problematic parents. My top five most severe problematic parents is the sex abuse incest, off the charts, sex abuse incest. That's an awful parent. Number two is the narcissistic borderline parent, because that parent is destroys the child. That's a psychological child abuse. They destroy the child from the inside out, and it's once they destroy that, it's almost unrecoverable at that point, because it's so pernicious. It's so involved. If we get a borderline mom who starts creating that borderline pathology in the child, that's just devastating. Um, and the loss, just the attachment, what they're doing, devastating on the attachment system. The attachment system, I talk about four um, types of relationship in the families. So, and they depend on gender. So, two are cross gender bonds. Those are the high affection bonds: father, daughter, mother, son. Two are same gender bonds. Those are the values and identity bonds. So, that's mother, daughter, father, son. Those are different bonds. And so, if I have let's say, a young daughter in the family, I've got the mother's bond is on the same gender bond. That's the values and identity bond. The father's bond is on the cross gender, high affection bond. Those are different places in the attachment networks for that young girl. Her relationship with her dad versus her relationship with her mom are doing different things in her patterns of security and her patterns of relationship. They're called internal working models by Bowlby. They're called schemas by Beck, but they're doing different things. Parents have different functions depending on the gender. And so a son is going to be on the cross gender one with his mom, but he's going to be on the same gender. And so it depends on the genders of everybody. When we have one of those devastated, so that daughter's relationship, she rejects her dad, so that relationship with her dad is devastated. I don't care what the mom's relationship looks like. I do, and it's a mess and everything. But I know for a fact that half of her attachment networks are an absolute terrain wreck. If I've got a daughter with a breached father daughter bond, that's a high affection bond. I've got no high affection getting to a high affection bond. Holy cow, that's devastating. And so this is child psychological abuse, and it needs to be diagnosed. And we need a proper risk assessment for possible child abuse whenever we have severe attachment pathology. The problem is, for the past 40 years, the court has not had that available because clinical psychology has not made that available. We've been driven away from the family courts. So the courts don't have an option to get a clinical diagnostic assessment for possible child abuse. The only option the family courts are given is a 6 to 9 month forensic custody evaluation that solves nothing. Nothing. And no treatment. The Just to let you know, if you think there's clinical psychologists over here because you get like treatment stuff, these reunification therapists, first off, there's no such thing as reunification therapy. There's four schools of psychotherapy: psychoanalytic, cognitive behavioral, humanistic existential, or family systems, postmodern neurodevelopmental as well, but basically four schools of psychotherapy. None of those have anything called reunification therapy. There's no book written about anything like that. There's no article, nothing. It's just a made up thing. And what they do is they use that word reunification therapy in the family courts, and everybody believes that there's some sort of therapy they're doing. No, they're just making stuff up, and then after the fact, they call it reunification therapy. And what the forensic psychologists do is they do custody evaluations in some cases, and in the other cases, they become the reunification therapy when somebody else does the custody evaluation. And each location, each region has their set of forensic psychologists who do custody evaluations, and they pass around the clients. And so they do repetition of the custody evaluations in the courts. But if they're not doing the evaluation, then they refer over to one of the other forensic psychologists for the reunification therapy that solves nothing ever. The diagnosis guides treatment. The treatment for cancer is different than the treatment for diabetes. If we try to treat cancer with insulin, the patient's going to die from the misdiagnosed cancer. So on these forensic evaluators who say, I don't diagnose pathology, well, then how do you know what to do about it? Are you making recommendations for cancer, or are you making recommendations for diabetes? If you haven't identified what the problem is, if you haven't diagnosed what the pathology is, then how do you know what to do to fix it? How do you know what to do to treat it? And I've got people like Stahl and Simon in their books and stuff saying, well, we don't treat pathology, we do something different. Yeah, I would love to get them answering questions, and I will ultimately in the court system, because they have to testify in support of their custody reports. I know that, and I've known that all along, that they have to testify in support of their custody reports. So they're going to have to answer questions. They can answer them more informally on debates and professional collegial discussions, or they can answer them on the witness stand under oath with a court reporter present. The ethical concerns are where I start when I do an analysis of a mental health report or a custody evaluation or something. I'm basically walking down three ethical standards. I'm looking for standard 2.01, 2.04 right off the bat. That's bases for scientific and professional judgments. So 2.04, did they use the established the established scientific and professional knowledge of the discipline? That's standard 2.04. And then if they didn't, the next question becomes, do they know the knowledge, the established scientific and professional knowledge? That would be 2.01, boundaries of competence. You look at their vita, say, where did they acquire their experience with attachment pathology? Where did they acquire their experience with, delusional thought disorders? Where did they acquire their experience with family systems? And so you look at their vita for 2.01, and then because if they don't know the knowledge, 2.01, and they didn't apply the knowledge, 2.04, then their opinions as contained in their reports, recommendations, diagnostic and evaluative statements, including their forensic testimony, are not based in information and techniques sufficient to substantiate their findings in violation of 9.01. So it's a trifecta there. 2.04 rolls into 2.01, rolls into 9.01. The information that they did not apply is standard 2.04. 9.01 cites right back to that. So they did not apply the information, 2.04, and the techniques would be the mental status exam of thought and perception relative to a possible persecutory delusion. And so we got the threesome on that. And if they didn't conduct a proper risk assessment for possible spousal abuse using the child as a weapon, and possible child abuse, creating the shared persecutory delusion, then they failed in their duty to protect the child. It's a negligent failure. Google negligent failure to take proper care in doing something. They failed to conduct a proper risk assessment for possible child abuse when the differential diagnosis is possible child abuse by one parent to the other, two-person, three-person causality. And so I'm going to be wrapping up here. I saw another comment go through about the five-factor model, and I'm assuming it's the five-factor model of Burnett about parental alienation. That's just first off, it's misleading because there's no factors involved. He didn't do a factor analysis. It's a five-part model of parental alienation syndrome. And if you look at his article, he says it's basically it's parental alienation syndrome of Richard Gardner with like lipstick. He's made up five categories of something, and that's basically because for for that group, the parental alienation experts, they're only expert in Gardner's PAS because they're only expert in things they can make up. They're not expert in attachment pathology. They're not expert in delusional thought disorders. They're not expert in family systems therapy. They're not even experts in the treatment for this, which would be dialectic behavior therapy. They're not expert in the DBT. So they're not expert in anything, but they want to be an expert so badly that the only thing they're an expert in is making up stuff, or stuff they can make up wholesale. So I would my position regarding the Gardnerian PAS experts, and I'll always put that in quotes, is that they are a fringe group of professionals who disregard the diagnostic or reject the diagnostic guidance of the American Psychiatric Association and who reject the ethical guidance of the American Psychological Association, and that the continued use of the construct of parental alienation in a professional capacity degrades the quality of professional mental health services in the family courts, and that to continue to present to the public this construct of parental alienation and not discuss shared delusional disorders, factitious disorder imposed on another, cross generational coalitions, emotional cutoffs, child psychological abuse, spousal psychological abuse, not discuss real pathologies while they're discussing in the public domain this made up pathology from a psychiatrist in the 1980s that's been totally rejected. That that um, that represents the spread of medical psychiatric misinformation to the general public that is harmful to the general public because it does not provide them with the professional level knowledge necessary to take the appropriate treatment steps relative to their family. So I have a serious problem with the PAS people. I'll debate any one of them too. You set up a debate, moderated debate, 2 hours online. Let's put it all the information up there. Everybody can listen to the debate and make informed decisions about whether or not we need to stop using the term parental alienation in the professional capacity. Yes, we do. We need to return to the established scientific and professional knowledge of the discipline as required by Standard 2.04. If they want to offer up new unicorns after the fact, after they apply knowledge, great. Apply the knowledge first. Because if you apply knowledge first, you won't need your new unicorn pathologies because the established knowledge is capable and will fully solve the problem in the family courts. We don't need new forms of pathology in the DSM-5. I am 100% in agreement with the American Psychiatric Association. I hear Bill Bernays tried to get the new parental alienation in the new DSM, any sort of revisions of the DSM, because a fixed and false belief maintained despite contrary evidence. He doesn't intake feedback and process it. He's gotten the feedback from the American Psychiatric Association. No, this is not a good diagnosis model. And it just bounces off. He doesn't accept it or process that information. One concern is once he passes away, because we're old guys, once he passes away, who's going to lead it? Who's going to lead this movement? And parents are left with nothing. Right back in the 1980s, left with nothing. No, we need to shift over to professional standards of practice to which all mental health professionals can be held accountable. We need to start holding the mental health people accountable for their child abuse, for their ignorance, for their unethical practices, including the PAS experts. Are they ignorant about family systems? Are they ignorant about delusional thought disorders? Are they ignorant about factitious disorder imposed on another? Ignorant about dark personalities, dark triad, vulnerable dark triad? Where did they get their background in attachment pathology? Where did they get their training in that? Children never reject parents. That never happens. Never happens. The attachment system is a primary motivational system of the brain. It's a goal corrected motivational system, meaning it always maintains the goal of forming an attachment pathology to the or attachment bond to the parent. It always maintains that goal. In response to problematic parenting, it develops an insecure attachment that more strongly motivates it to bond. It never seeks to reject a parent because there's a predator over there who's going to eat the child. So, so the set goal of the forming a bond to the parent is always there. Children do not reject parents. That just doesn't happen. But people in the family court, these forensic psychologists, are just ignorant like a rock. It's a false attachment pathology imposed on the child, factitious disorder imposed on another. And if you know anything about the attachment system, it's easy peasy to pick it up. So my 3 diagnostic indicators, I can make the diagnosis on any one of those. I gave them 3 because they're ignorant. So with that, I'm going to head off to my Sunday here. Good luck to everybody. I want to say apologize for my professional colleagues who are abusing you in such a brutal and cruel fashion, destroying your lives. But there's no apology that can even come close to the destruction that they are inflicting upon human beings. It just rips my heart out that you're being made to endure the grief, complex trauma, grief, that you're being traumatized. You're being traumatized by the psychologists who work with you. Complex trauma, they're taking your kids away. I'm a trauma psychologist out of foster care. That's what I'm doing here. I'm not here to be an expert. I'm not here to solve things. I'm here to solve things. I'm not here to participate in their stuff. I'm in a situation of active spousal abuse and active child abuse. I'm a clinical psychologist, and I'm working to stop it, to stop the abuse by the psychologists, by my own. I'm working to stop the child abuse and spousal abuse by the forensic psychologists. Yikes, cowabunga. So with that, everybody have a happy Sunday. Bye-bye.